This is an interesting study that we got involved with looking at, it's a new technology that allows us to put in feeding tubes called gastrostomy tubes that can be done entirely under ultrasound guidance. The types of patients who typically need feeding tubes are either people who can't swallow because of an obstruction, so a cancer either in the throat or esophagus, or others that can't safely swallow either because they've had a major trauma and have brain injury, or they've had a stroke, or just some people with age can't safely swallow without food going into their lungs and causing infections. So gastrostomy tubes for those patients who need it are a lifesaver. I mean, ultimately, food and nourishment is a key component of anyone's survival, and for patients that can't eat or can't safely eat, malnutrition becomes a major concern for them. So gastrostomy tubes are key for them to be able to get the nutrients and nourishment that are needed. Traditionally, these gastrostomy tubes are put in one of two ways. They're either put in the interventional radiology suite using X-ray or fluoroscopy to help guide it in, or put in the endoscopy suite using a camera and scope to help navigate these in. Percutaneous ultrasound gastrostomy technique, or the PUG technique that we've trialed, is a unique technology in that it allows us to put in these effective gastrostomy tubes, but just using ultrasound on its own. We use a standard gastrostomy tube that the gastroenterologists would use when they do an endoscopic insertion, but instead of having the camera put in the mouth down in the stomach, we place a balloon that has a magnet on the end, and we feed that in the mouth, down the throat into the stomach. And then we put another magnet just on the skin of the abdominal wall, and that pulls that balloon magnet up to the front of the stomach, and then we can fill that with water. And once it's filled with water, we can see that on ultrasound. That gives us a target to puncture with our needle. And then we take a needle from the skin, through the abdominal wall, through the gastric wall, and right into the balloon. And then through that needle, we can feed a wire that's then captured in the balloon. It's pulled out of the mouth. And once the wire is out of the mouth, now we have a wire kind of coming through the skin, through the stomach, out the mouth, and we can feed our tube from the mouth down and pull it all the way through, so that we're left with just the tube going from the stomach right out the skin for feeding. Another benefit of the PUG procedure that can be performed in rooms other than an angio suite, an interventional radiology, or an endoscopy suite, and that frees up those rooms, which are valuable resources for them to be used on other patients that need those services and that technology. This can be performed bedside, so patients that are critically ill in the ICU, we can come to them and do the procedure right in the ICU without having them, without requiring them to be moved. With this new technology, we were actually fortunate to be the ones to be the first to do it in humans, as well as the first to do it in bedside in an ICU patient. There's been a lot of interest, particularly from some of the ICU physicians. The not having to transfer their patients has been a huge, they feel has been a benefit. Development of the technology has been also exciting for myself and my colleagues being involved, developing sort of the new technique and seeing how we can optimize it to improve patient care has been quite rewarding.